Hi, my name is Abby Sterrett with University of Maryville. This is my advanced assessment. Before beginning this exam, I obtained the patient's vital signs, got his height and weight, had him empty his bladder and change into this gown. I also got his visual acuity with using the Snellen chart, and before entering the room, I performed proper hand hygiene. Hi, my name is Abby Sterrett. I'm going to be performing an advanced assessment on you today. To begin the advanced assessment, first I'm going to be looking at the head and the face, just looking at the general appearance of the head and the skull, noting any bulging, any concaves, and any irregularities. Also noting the hair texture. I'm going to go ahead and palpate his head. No bulges, normocephalic, no tenderness noted.
Nope.
I'm going to palpate the facial structures. I'm also, with that first assessment of general view, I'm looking at the placement and the symmetry of all the external structures like the eyes, the ears. Palpate make sure they're all intact. I'm going to next palpate your sinuses, feeling for any swelling, noting any tenderness. Any tenderness noted?
Nope.
Okay. Next, I'm going to be looking at the eyes. First, looking at the eyelashes, noting that they're all facing outwards. Looking at the eyebrows, looking at the hair texture, looking at the sclera. Noting the color, making sure it's white and not yellow or any excess inflammation. And then I'm going to look at your conjunctiva. I'm going to have you look up. Good. You want it pink, moist, not excessively inflammation or red. No foreign bodies noted. Have you look down. Good. Same with this side. Good. And then I'm going to palpate your lacrimal apparatus. Any tenderness with that?
Nope.
The lacrimal apparatus is typically not palpable, but if there was an obstruction, you would note some excess edema, and also you would note some tenderness. I'm going to go ahead and look at your pupils. Checking for both direct and consensual movement. Direct, consensual. Good. I'm going to have you look at this and look at the wall behind you. Back at this. Good. So eyes are equal, active, reactive, accommodate well. I'm going to have you follow this. Checking his eye movement, looking for any nystagmus or eye jerking with the cardinal points. Good. And there was no eye jerking or nystagmus noted. Next, I'm going to be looking at the ears, looking at the external configuration of the ears, the symmetry. Good. And then palpating the auricle, feeling for any tenderness or masses. And now I'm going to have you cover one ear at a time, and I'm going to whisper a word, and we're going to perform the whisper test, and I'm going to have you repeat the word. So let's start with this side.
Cat.
Good.
Purple.
Good. Okay. Now I'm going to just go ahead and inspect your ear canal. Good. Looking for any excess drainage, looking at the hair, looking at the membranes, noting the color. You would note any inflammation if there was any present. Next, I am going to look at your nose first, looking at the external structure of the nose, looking at the position of the septum. I'm going to go ahead and look up your nose, looking at for excess drainage, looking at the hair, the turbinates, noting the colors, noting any nodules if there was any nodules. Next, I'm going to have you cover one nose and breathe in, and then good. The other side. Good. Just checking that each nostril is patent. I'm going to have you open your mouth here in just a moment. I'm looking at the lips, the symmetry of the lips, making sure they're moist, not excessively dry, looking at the symmetry. Go ahead and have you open your mouth.
Okay.
Good. Looking at the buccal membranes, the soft and hard palate, looking at the teeth, making sure the teeth are all intact, making sure there's not a lot of plaque or teeth missing, noting any mouth odor. I'm going to go ahead and look at the structures here. Open your mouth real wide. Good. Say ah.
Ah.
Good. Looking at the anterior pillars, posterior pillars, the uvula, making sure it's midline, looking at the posterior pharynx, and looking at the tonsils, noting any lesions throughout the mouth or any swelling on those structures. There was none noted. It was all clean, pink, and moist. I'm going to check your gag reflex. So open up real wide. Good. Good. Sorry, I know that's uncomfortable. Next, I'm going to just check your sensation of your face. So you tell me when you can feel this.
Okay.
On the forehead,
Okay.
cheek,
Mm-hmm.
and jaw on both sides.
Mm-hmm. Yep.
Good. I'm going to have you perform these tasks, looking for the facial symmetry with these. I'm going to have you clench your teeth, close your eyes real tight, wrinkle your forehead. Good. Puff out your cheeks, smile, stick out your tongue. Good. Looking for facial symmetry with that. No unilateral movement. Next, I'm going to be looking at your neck, noting just the general smoothness, the symmetry of the neck, noting any swelling. Also looking for any jugular vein distension, which there's none. I'm going to palpate your trachea, making sure it's midline. I'm going to palpate your carotid pulse on each side. Strong and equal. I'm going to go ahead and listen to that, listening for a bruit. I'm going to palpate your trachea again, and then feel out to the side and feel your lymph node. This side, so I can have you swallow. Good. Noting if there was any nodules or any inflammation there. I'm going to move your neck, and then I'm going to have you perform the same series. Just checking your active and passive range of motion of your neck. Good. I'm going to have to do the same. Any difficulty or pain with that?
Nope.
I'm going to go ahead and check your lymph nodes, starting with your pre-arcular, your post-arcular. your occipital, tonsillar, your submandibular, submental, superficial cervical chain, posterior cervical chain, your deep cervical, and your supraclavicular. I'm going to have you shrug your shoulders for me. Good. You can have the patient shrug their shoulders and feel along with that. I'm going to go ahead and assess the shoulders, the arms, and the hands, looking at the general appearance of the skin, noting the skin color, any skin variations, if he has any skin lacerations or just rash or anything irregular noted, the hair distribution, and then looking at the color of his hands and his nail beds. They're pink and they appear to be dry, so I'm going to palpate. Noting the muscular tone and any sensitivity or tenderness. It's nice and dry and warm. Check the cap refill. Good. Less than 3. I'm going to check the radial pulses on both sides. Nice and strong and regular. And the brachial. Good. I'm going to squeeze my hands. Good. And relax. Good. Okay. I'm going to have you go ahead and turn around so I can assess your back. So when looking at the back, first I'm going to inspect just the general thoracic configuration, the overall appearance of the skin, noting any irregular skin lesions. Also just noting his respiration efforts, looking at the movement. I'm going to check your symmetry of respirations. Take some big deep breaths for me. Good. Just looking for symmetrical rise. Good. I'm going to go ahead and percuss. I'm going to move this so they can see better. Can you angle a little bit?
Mm-hmm.
Good. I'm going to have you repeat a phrase 99. I'm going to check the tactile firmitus.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So I'm just checking the consistency throughout with that. I'm also going to check for diaphragmatic excursion, looking where the diaphragm lays versus with respirations at rest. To do that, I'm going to percuss from resonance to dullness. Okay. With that, I would have you take a deep breath. I'm going to do that once more. I'm going to have you take a deep breath and hold it.
Okay.
Okay, you can breathe. You take a couple breaths. And have you breathe out and hold that. Now I'm going from dullness to resonance, and I'm marking that difference. You can breathe. So I would measure that difference between the 2 points and repeat that on that same side. You would expect the findings to be 5 to 6 centimeters and symmetrical on each side. You can just relax and breathe. I'm going to go ahead and auscultate your lungs. Taking some big deep breaths. Perfect. Okay, you can just breathe normal. Lung sounds are clear and equal all throughout. I'm going to have you go ahead and turn on all the way around here so I can look at your anterior chest. I'm going to expose your chest, but I will keep you covered. So again, just looking at the general appearance of the chest, noting any deformities. He has the pectus excavatum deformity of his chest. Looking at the respiratory effort, noting any pulsations, if he had any, and any heaves. I'm going to go ahead and palpate your chest. Palpate the apical pulse. Noting any thrill. We're going to repeat the same thing we did before with the tactile firmitus. I'm going to have you repeat 99.
99, 99, 99, 99, 99, 99, 99, 99.
Good. So I'm looking at his respiratory effort. I would note any abdominal muscle use, looking at the expansion of his lungs, making sure it's symmetrical. I'm going to go ahead and auscultate your lungs. Big deep breath. Okay, you can just breathe normal. Next, I'm going to be listening to the heart tones. First, listening to the aortic valve. The pulmonic. Herb's point. Tricuspid. And the mitral. Good. All were regular. No murmurs noted. You'd be listening for murmurs on those valves. I'm going to check your axillary lymph nodes. So have you turn up good. And your infraclavicular side. I'm going to have you go ahead and lay on back so I can assess your abdomen. I'm going to have to make sure they can see you. So I'm going to be looking at the abdomen, looking at the general appearance of the abdomen, looking for any pulsations. I'm going to listen to all 4 quadrants. I'm going to listen to the arteries with the bell. First with the aortic. The renal. The iliac. And the femoral. Iliac. And the femoral. Listening for any thrills with that. I'm going to go ahead and percuss the abdomen. On the right side, percussing the borders of the liver. And on the left, the borders of the spleen. And I'm going to lightly palpate. Any tenderness with that?
Nope.
By marking the borders, I'm going to then palpate on the right side the liver. And the spleen. And the kidneys. I'm going to have you go ahead and sit on up. I'm going to have you turn back around. One more thing I need to check on your back.
Okay.
I'm going to check the costovertebral. Do you have any tenderness there?
Nope.
Good. Okay. Perfect. I'm going to have you turn all the way back around towards me. You can cover yourself back up. I'm going to assess your legs. Looking at the legs, looking at the general appearance, the hair distribution, the color, I'm going to go ahead and palpate. They're nice and warm. Palpate your feet. I'm going to check the pulses. Cap refill, less than 3. First, starting with the dorsalis pedis, both feet, the posterior tibial, and the popliteal. Good. Next, I'm going to check your reflexes, beginning with the Achilles tendon. And then I'm going to do the brachial. Just have you relax as much as you can. Good. So, good. Before beginning my neuro exam, I'm going to have you open and close your jaw. Checking the temporomandibular joint, checking for any popping or clicking that would be noted with that. And then I'm going to do my neuro exam. So we've done a lot of these already. The olfactory number 1 we are not going to perform today. Optic we already performed with the Snellen chart, the chesting, the visual acuity, the ocular motor, the abducens, and the trochlear. We checked by following those visual points. And then the trigeminal, we checked with the sensation of the face, and the facial with the symmetry of those movements. They were all symmetrical. Next, we are going to do the vesticochlear. So I'm going to have you, first I'm going to place this on your head, and you're going to tell me which side you hear this in.
Okay. Both.
Both. Good. Midline is the correct response with that, normal response. I'm going to next, that was Weber's test, I'm going to do Rene's test. I'm going to place this outside your ear, and you're going to tell me when you stop hearing it. I'll place it on your bone there and the occipital bone, and you tell me when you can't hear it anymore.
Okay. Okay.
Good. And that's a normal response, being twice as long, air conduction versus bone. We're going to repeat that on the other ear.
Okay. Okay.
And we are also tested that by doing the whisper test during the assessment. I'm going to have you, we did the gag reflex for the vagus and the glossopharyngeal. I'm going to have you, sorry, the hypoglossal. The glossopharyngeal, I'll have you stick out your tongue. Perfect. Looking for, you can relax, looking for any deviation from one side to the next would be an abnormal response. I'm going to have you shrug your shoulders. Accessory, making sure that's intact. Good. Okay, and that completes my exam. Do you have any questions?
Nope.
Perfect. Thank you so much.